This pharmacology topic is oxytocin. Oxytocin is produced by the hypothalamus and then stored and secreted by the posterior pituitary gland. While oxytocin is found in both males and females, oxytocin plays several important roles in clients who are pregnant, both during labor and the postpartum period. First, oxytocin is a powerful uterotonic agent and the primary hormone that causes uterine contractions during labor. When true labor begins, oxytocin is released from the posterior pituitary gland, and this creates a positive feedback loop, as we can see in the image on the right. The uterus contracts in response to oxytocin, which puts pressure on the cervix, which sends signals to the brain to release more oxytocin, hence the positive feedback. This cycle continues until the birth of the infant, when there is no longer pressure on the cervix and less oxytocin is released. Oxytocin is also important in releasing breast milk. As the infant breastfeeds, the posterior pituitary gland is once again stimulated to release oxytocin to release breast milk. Lastly, oxytocin helps the baby bond with the birthing parent. Synthetic oxytocin may be administered to clients who are pregnant to induce labor or increase the intensity and frequency of uterine contractions to help labor progress, as described on the last slide. Synthetic oxytocin can also prevent or manage postpartum hemorrhage since it causes the uterus to contract back to its previous size. It also acts as a vasoconstrictor to prevent or stop postpartum bleeding. Oxytocin has several significant adverse effects and requires frequent monitoring and incremental dose adjustments to avoid complications. Excessive and too frequent contractions can occur, which can reduce placental blood flow and decrease oxygen to the fetus, causing fetal distress. Uterine rupture is also possible if the contractions are too strong, as you can see in this image. Because oxytocin is structurally similar to antidiuretic hormone, or ADH, it can cause water intoxication. Too much water retention can result in dilutional hyponatremia, leading to drowsiness, headache, confusion, vomiting, convulsions, and even death. Lastly, oxytocin can cause hypotension and tachycardia, decreasing oxygenation of the client and fetus. To avoid these serious complications, it's important to administer oxytocin properly. Oxytocin should always be delivered with an electronic infusion pump to ensure the dose is accurate. This also prevents the client from receiving an accidental bolus of medication. The infusion begins at the lowest possible dose and is titrated slowly until contractions are moderate to firm in intensity and 2 to 3 minutes apart. During the infusion, the fetal heart rate should be monitored continuously to detect any potential problems with the fetus, and the client's blood pressure should be monitored frequently to check for hypotension. The client's fluid intake and output should also be closely monitored to avoid water intoxication.